Как будет готово, скажете? Так, давай, Корик. Так, екінші шпиц найдеші. Так, бітесін, мен қазір жібере бастайын. Ортасына жеткен кезде я тебе переключу и сен жалғастырасың, хорошо? Кастратор. Каст, пока айналасың. Каст. Что басаешь? Дальше. Мен переключать этому кезде сен жалғастырасың, хорошо? Өйткені сәл контраст көптеу керек болады. Так, давай жалғастыр. Каст. Bir секунд. Görür. Ana koyuyor stolda onu. Қайтадан қоясың. Қазір тұра тұрып. Секунд. Bir секунд. Başa kesilip gitti. Қазір. Так, нажалуйся. Қазір. Қайтадан қоясың. Ага. Баса бер, баса. Қайтадан бас. Так, сен бастайсың, мен жалғастырайын. Хорошо? Қазір тұра тұр. Так, бастай бер. Бастай бер, жүргізер. Давай. Все. Аны орнына қойсың. Maybe now is better, eh? Okay. Yes, now it's better.
Let me do a new one.
Yeah.
Have some stuff from ACA as well.
Yeah, it might be small stuff. But the last time it was like Moya Moya. We couldn't go A1 and now it's changed completely. Yes, it's interesting.
The MCA was Moya Moya.
No, A1.
A1.
A1 was Moya Moya. That's why we went through the MCA.
So your idea is to get this one.
Yes. And the back part is look like more collateral.
Yes, this one. Maybe this is also
Yes.
connecting with
with ACA, yes. And there is some stuff connecting with the extracranial.
Yeah.
Звук подключили, да? Наталья? Ага. Идет, да, звук? Ага. Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. We are from Almaty, Kazakhstan, and today we are together with our friend from Spain, Alberto Gil. He's in Almaty together with Carlos. And we started our first AVM case, 35 years old gentleman. After 2 sessions of frontal AVM embolization, one access from the lenticular artery. There is some part of the AVM coming from the external carotid system and the main territory. It was Moya like changes in A1 segment at the time of last treatment, but today, surprisingly, A1 is opened and it's also was supplied from the PCA to ACA, but today this territory is normal. Okay. It's a tight. The main supply from MCA and yes, it's a back part. It's a deep vein also. But the main
so
drainage to sagittal. Okay.
Explore 3.
Okay. 3 branches. Okay. Okay. Let's go. Не, чекай 8 аж пересанше. Бах. Чекай 8. Ага, прямо наш санс. Ровно вересанс. Ровно вересанс. Так, и даем соджи на кое слышь? Угу. Так. Трубкан вверх это расслался. Okay, and also for the closed group we have a Zoom connection for the colleagues, and if you have any questions you can ask the questions in Zoom. It's also possible to say hello, and audio is also available in the operating room. And happy Nowruz. Nowruz is a new year. Okay, let's see. 1, 2, 3, 1, 2, 3. Okay. We have a 8 French guiding, which is coronary guiding Hyperion. And now we took headway duo 156 with the Chikai 8. Nowadays we have little problem with the Sonic. Sonic now coming without hybrid, just a micro catheter. That's why we need to work with the Chikai 8. It's not our regular stuff, but we used to work with Chikai 8, very limited. Usually it's a hybrid. Okay, let's see. And we already done 3D angiography, and Alberto did the analysis for the 3D, and we will give also the microphone for Alberto. And let's see what we can do. Okay. Okay, now it's possible to, let's zoom it. Yes, the first 2 sessions of treatment was in Astana, in Presidential Hospital, where I'm working for 5 days in a week, and then on weekends we are together in Almaty. Okay. Let's prepare for the MC also. Yes, it looks like there is a cortical veins, and there is a MC aneurysm. You can see.
But I don't.
Smoke mask. The last time A1 was not visible, and now it's opened. It's surprising. Huh? What kind of penal lumps are there is ophthalmic aneurysm also. Quite high flow to the MC territory, that's why might be problem. First of all, we are planning to check the ACA, and then it could be okay with the MCA. Let's check the ACA first.
Do you have 7?
This territory, it's okay.
7. No 7?
Okay.
Okay.
Столбницу кубову дръжката сталкваше. Въркубик. Okay. Just a second, we need to pull down and like this. There is crazy stuff on the ACA. Вперед. Назад. I think it's enough, Alberto.
What?
Do we need to proceed forward or it's enough image?
Maybe you can get in the
Lower one.
no, in the yeah,
The upper? The lower?
up. I will go up. Yeah,
Okay.
the main branch. Or why not both
Okay.
to understand everything better?
Smartness class.
But
Yes, and last time we couldn't go to this territory because of Moya changes in A1, but now it's really surprise. We can go to the A1 segment. On Wednesday, I will find the images from previous treatment and will show you. Okay. It's a headway duo. That's why it's look stiffer.
and what do you think? It was a Moya and now it is not anymore. What do you think the Moya disappeared?
Let's see on Wednesday. If I'm correct, it was like this. Okay.
Okay.
It's mostly collaterals.
Yeah.
Назад?
Indirect collateral feeders.
Yes, it's indirect.
You have the deep vein here,
Yes, it's a deep vein. Okay.
and then a cortical vein up.
Okay, let's check the upper one. Проводник, please. Проводник, please. I don't know how in Spain, but now in Kazakhstan we have Sonic without hybrid. The new Sonics
Yes,
are
it's the
coming
same.
without hybrid.
It's the same.
Same. It's as usual possibility for Asahi company to take part of the market. All the time when the old company has a problem with the material, it's a possibility to second company to take part of the market. Okay. I think it's lost the shape.
Try the catheter.
Recording in progress.
Hey, it's quite stiff. Okay, zoom is on. Okay. The people are sleeping because today is Saturday. Yes. Contrast feeders. Okay, let's check. It's the most superficial part.
Yeah.
But there is not so big network, huh?
No. So indirect. The vein is not so
It's like
fast, but the remnant is up there. Huh?
yes, it's all.
Okay, so not much to do. from this side.
Let's go to the Mynzhylky recovery. It's the posterior part. Он 6 градусов ХВС, слышишь, кондиционер? Градусов, он 6 градусов. Yes, both branches is coming from this part. Кондер, он 6 градусов. Кондиционер, он 6 градусов. That's more direct stuff. Okay, let's... I think there is one more branch from anterior part.
So the idea is to reduce the main one and then surgery.
I think yes, because
Yeah.
the posterior part is more functional, and I think the surgery is a good option to finalize the treatment. Okay. I think it's enough. Okay.
Oh,
Huge one,
still important, yeah.
Okay, I will take another one. You can check the... It's still a lot, huh? But it mostly collaterals, huh?
Yeah.
Mostly collaterals.
Can I take a look to the 3D with the mouse? Okay.
You can replace,
Okay.
change the places of interventional pulse and review. Just take and push up. Just a second. Just a second. You can do it like this. Then you have
Ah, okay. Great.
more
Thank
space.
you.
It's possible only in this Philips machine and in Astana also. In other places in Kazakhstan, Philips didn't open this option for the users. Okay. Now we are in the MC
How do
territory.
you activate? Okay.
Ah. Yes. Let's also cover the deep part of the AVM. Okay. Yeni birisi. Проводит birisi.
maybe this one is not bad neither. This one.
Yes.
This one is so
This
indirect,
tone? Yes. And this is
but this
more
one I'm
direct.
not sure.
Okay, let's check with the sonic because
Is
should
this
we
one
do-
here? So at some point it's very close also to the
Okay.
nidus.
and
and
it's
maybe-
mostly superficial, and this part is also draining deeply. The second branch.
Okay.
And let's check the anterior
Okay.
one, frontal one. Okay. Take it out. Yes, there are minimum 2 branches going to the AVM. Назад. Stop. The branch is going чуть-чуть вперед. Stop. The branch is going frontal at this part. Yes, this one, I think. Yes, both of the time we have been here, and we took part of the AVM from this branch, and yes, one time we have been at the territory of striating artery, but at the time of striating it was small bleeding. It was last treatment, and neurologically it was okay. Yes, there is still some stuff from this part. It's mostly superficial. We can go from this, but it's too collateral, huh?
Yeah. So indirect, collateral.
But it's quite safe than posterior one. Okay. Let's take posterior. Let's go with the sonic. This one. Чекай. Чекай долу. Бір секунд. Окей. Взял. But the frontal part, I think this territory we should also occlude, because it will take time at the time of open surgery. Yes, there is one more session should be for both meningeal branches, and yes, we started without explaining. Just a second, we will do super selective angio, and then we will explain which part is which. Okay. Okay.
Yes. And then anterior.
We need to go to the
You want to take,
this part, yes? This part,
Okay.
or this.
so you did this, that, and this is the last one you have.
This was first, this was second, and this was third.
Ah, so you already did this one, I didn't see.
And now we can go to this part. That branch you
Okay,
explained.
let me check.
Okay, let's see. Just a second. Alberto. We can do it like this. And this is the posterior part. This branch,
This is the posterior branch, huh?
yes, posterior branch. This one.
Yes.
We can go to this territory.
Yeah.
it's coming here. Okay, let's start from the beginning. Just a second. To clarify the situation, the last time it was supply from the vertebral artery to the ACA territory because of this moya changes. And now you couldn't see anything from the vertebral artery. And from the left side, it's not so much AVM visible, but with the selective catheterization, we could see some remaining part of the AVM with the low flow, not high flow. And on global view, it's not so visible. Okay. Then we asked Rowan to do external circulation, and there is some part is feeding from the meningeal branches. You can see the vein on lateral, and the same we asked to do from the right side. Okay, this is the regular protocol. Just a second. And now it's MCA territory. There is an aneurysm in M1 segment, and also, no, it's normal. It was looked like also aneurysm on ACA. Now A1 is regular. I will find the older images and will share with you. Okay, and this is external circulation. Very tortuous meningeal, supplying the middle part of the AVM. Okay. Then it was 3D. After that it was 3D regular without contrast, and now with contrast. Okay. And after that we did the ICA territory. This is posterior part, middle part, and the frontal part. And we went to the ACA territory. You can see there is a remaining indirect part of the AVM. This is a lower branch of the pericallosal, collateral flow. This last time we occluded this part together with some part of the callosa marginal, and now it's supplying with collateral feeders. Okay, this is MCA territory, and with analysis of 3D, this branch is going more directly to this part of the AVM. We will go with the sonic more closely, because the headway duo is a little bit stiffer. Maybe after placing the sonic it will be easier to ship it. And this part is also supplying from meningeal. And the veins are mostly cortical and one deep vein. And after that we went to the anterior part, and there is still some collateral filling of this part. Okay, we have Zoom connection, Alberto, and there is auditorium.
Okay.
Yes, and we
Can you hear them?
They can hear, I think. Наталья, сколько человек у нас в Zoom? Okay, let's put it as a smart mask. I will go to the posterior part.
Okay, great.
Okay, we left the headway duo in frontal branch.
Okay.
And now we will go. Okay. In YouTube, 4 person. In Zoom, nobody. Okay, let's see.
Let's
Maybe
wait.
Let's wait. They're sleepy.
It's very early.
It's a time difference, huh?
Yeah.
Okay, I think we can go this
Go,
part.
go, go,
and
go,
then-
go. The
Okay.
farthest you go, the more
Okay, but
clear
there
will
is
be
a
the
limit
anatomy.
of sonic.
Yes. Okay, that is good.
I think it's good. Okay. Бързо, капвайте. Бързо. Then we
So
can
you
push little
navigate
bit
with a
wider.
hybrid and with
Yes.
a Chikai 8.
Yes.
Okay.
The first was hybrid. Okay, we can push guiding catheter a little bit forward, but with sonic you need to keep in mind there is a marker, and at the point of this marker the catheter became stiffer, and it's usually hard to push it. Unfortunately we have no extended length sonic, but I think this part is quite safe to inject. Huh?
Yes, for me this is because which one do you think is the central sulcus artery?
yes.
The one in the middle, no? You have precentral, central, and
I think
this
this one
this is parietal, no?
it might be parietal,
Yeah.
but with the okay, just a second. Just a second. I will move a little bit. Now we can see the coronal suture. This one is coronal, and then 3 centimeter is a central sulcus, and this is exactly at the level of motor cortex.
This one.
Yes, this one.
So you prefer to go.
Maybe we can inject, no problem.
So how do you know? Because of the MRI?
On MR it was look like
Motor.
premotor, not the precentral. It's one before.
Okay.
Yes.
So why not go into the more anterior one? I mean the other one. Because this one is good because there is a lot of stuff, but there is more risk of ischemia.
Paresis,
But
yes.
if we are
Okay.
distal enough, which is the case,
Yes, but we're distal enough, huh? And then it's mostly AVM. And then it's mostly AVM.
yeah, you still have some collateral network.
Yes.
This is arterial anastomosis, and then nidus is here.
Yes. Let's pull a little bit the sonic and then we can see. Okay.
Maybe we can also explore
The middle one? Or
the middle one with the more
anterior
distal
one.
location.
Okay.
Because for me this is a lot of indirect feeder before the nidus.
Yes.
Could be an option.
Okay. Let's do it from here. Okay. It's mostly going to the AVM. Yes, it's mostly AVM. But at the time of surgery, this part will be resected.
Will be?
With surgery, this part will be touched and resected. Yes, coagulated.
We can do the same in the anterior one to see the one you wanted to go.
The
Which I
middle
think-
one, yeah?
Yeah, the middle one.
Okay. Let's something here. Something here. Okay. Hybrid. Hybrid press. I think it's okay. Эхом отдает. Наталья? I don't know why there is an echo in speaker in dynamic. Ну, абсцесс просто. Дальше ходи. Смарт маска. Предыдущий ХС шанги. Стоп. As hybrid is hybrid, huh? It's different behavior. Okay, just a second.
Yes. Yes, this is the one. Yes, now you have to go back distally. Down, yeah, like this.
Yes.
I think that the sonic maybe can go alone.
Yes.
Yeah. This is a small branch.
I think we went to the small branch. Okay.
Maybe you can go back to this roadmap.
Yes.
It's
Okay. Okay. Okay, that was better. Okay. Okay. Just a second. What's here? Extra 5 centimeters.
yes, this is the more direct one.
Yes. But then we are directly in the venous side. Huh?
There are have to go
Two branches.
more posterior,
Yes.
more lateral.
It goes lateral one. Okay, we need to go a little bit forward.
Sorry?
We can go forward and we can take
Sure,
both
sure.
branches.
I will go more
Yeah.
more lateral. In this, there is a main feeder. You see there?
Milosevic? Okay. That's
Yeah, this is the good one, huh?
Yes, that's a good one.
Yes. This is the main feeder, huh?
Was it?
Of course, it is more close to the vein because it's the main feeder. So.
But then there is a risk of vein occlusion.
Yeah, so you have to take
You have to
care
be
of the
careful.
vein.
Okay. I think we can place one sonic here, and we can place one sonic in frontal branch, in anterior one, and then we can inject from both branches. The anterior one for preparation for the resection, and this part to
So
shrink the.
the goal of the treatment is to prepare the patient for surgery, huh?
At the end,
So-
it will be surgery, yes.
Okay, so because you have a lot of collateral indirect stuff which is impossible to get from the
Posterior
arteries.
flaps, yes.
Um, So I think this is good to reduce
Yeah,
the
reduce
morbidity
the
of the
amount
surgery,
of-
but
yeah.
maybe don't try to get so deep
Yes.
because you have the risk of venous
Yeah,
occlusion.
yeah.
And then if you want to
I
do
agree,
the
yes.
anterior one as well,
Yes.
we can do it maybe because you want to do pressure cooker or reflux.
We can place couple of coils
Okay.
here, and then in anterior we can do
Okay.
just injection.
The problem with coils is that it works at the beginning, but if you want to penetrate more, maybe it doesn't. But if you don't want to penetrate too much to avoid venous
Yes.
occlusion, maybe it's enough. Okay, so which one do you want to start with?
I think this one.
Okay,
Okay.
but I think
Well-
Sonic could do also this
Yes.
last turn.
And there is also another branch, the proximal one.
Yes, but it seems to be more indirect.
Okay.
Look at the last. Look. Means you look in A,
Yes.
it goes like more indirect.
It's going anterior part. Huh?
Yeah. You want smart mask here? Yeah.
Yes.
So your guiding is an 8
8
French,
French, yes.
0.88.
Yes.
Okay.
It's a coronary. A big lumen.
Asahi.
Asahi Hyperion. It's a regular stuff.
Yeah, it's very nice. I saw it previous time I was here. Okay, so I think you already almost in place.
The small stuff. No, I think the bigger one.
It's going to a small.
That's a small branch. Again in the small branch. It's like it's small. Now it's
Okay.
better. I think it's enough.
Perfect.
Perfect. Then we need to go with the headway duo and place a couple of coils. Yes, it's like this. Oslar koyasın.
Чекай.
Okay, thank you. Let's see if we can do it a little bit more. Yes, headway is stiffer, and Alberto, we have 5 spiff coils.
Sorry?
We have 5 spiff coils.
Oh, good.
Yes, if it will be needed. Okay. Okay. Предыдущий день koysaš angiografin? Джоджо, osna smart mask koysaš? Let's see. It's not
Oh,
visible.
you don't
Okay.
see it properly.
Okay.
Yes. No. Yes.
Okay. This part is okay. Just a second. There is a bifurcation, huh? Small, deeper part.
Going to both cortical. This is a transmedullary artery is going to the deep part,
Yes.
and the other is more
Superficial.
cortical. So, where is the vein?
Period.
Maybe we can do some more
Vein is coming here.
cranial angulation to see.
Okay. Yes.
Yes, usually the vein is in middle of
Yeah,
the
in
holes
the
of the
solid,
previous
yes.
cast.
Yes.
Let's see.
Okay. This one is better, I think.
Okay, so now you can see the primary vein there.
Yes.
Okay, so you see the primary vein up.
Назад. Вперед. Stop.
Okay, so this will
It's
be
coming
short.
from
Yeah.
here. Huh?
Yeah. And maybe there are other small ones.
Just a second. Ah, you can do it like this, Alberto.
Oh,
It's possible. Just press and wait.
Okay.
Okay.
so
Just press and wait. Okay, now it's okay.
so this is clear. This primary vein is very clear.
Yes.
But I think that there are others
Another one.
shorter here because if you see there are some other
Yes. The
small ones
bifurcation.
there, so we have to pay attention to this. And in lateral, I'm not sure if we can improve.
Lateral.
Lateral, you can see some kind of vein coming
Something
here.
is there. Yes.
Okay.
It's not 6D, eh? Okay.
Now the main problem is the previous cast.
Yes. Spiral. Okay, nobody is in the zoom. Abzal and Evgeny in the zoom. Okay. 2x6, I think, helical soft.
So what are you planning to inject here?
Aptura is okay? I
Which?
think, yes.
20? Yeah.
20
It's
is
better
okay.
20 to avoid.
Yeah. Also
20.
потом държавната турта. И отделялкасын дайындап қоя саласыз ғой? Иә, ашып бере саласыз. Бізде ашылмаған жоқ, да? Бар ма? Ашып бере салшы. Okay, we asked for microplex 2x6 first. The first will be microplex 2x6 and then the second will be 1.5x4. Roll, itirer.
Okay, so we can keep here as reference
Yes.
images.
It's okay.
Blank roadmap? Do you want blank?
Yes, blank roadmap like this and then glue.
Okay.
Put it at the second, I think it's better. That's also.
We need the embolic agent.
Okay. Не туда, не туда. Just a second. Как инженер? It's a human factor. It's a human factor. Okay. No problem. We need to take headway duo. Okay, let's check. Ayma, there's Sonic hasal жүріп.
¿Tienes tu aguja?
No, it's very important
Do you
to
have
close it. So,
bigger? No, this is the only one. Okay. Okay. De menso ya tenemos. 20, ¿no?
Bien.
¿Quién?
Yo.
¿Por? Sobada. No, es que yo porque estoy aquí en la primera línea. Vamos a cargar otro para que no haya que correr.
Тағы да бір 2-де 6 бересіңізші. Бақыт. Okay, it's detached. Оны алсақ. Қоқтай. Olur. Так, ана физраствор бітейін деп атқан кезде айтасыздар ғой, австрасына.
Okay. Sí.
Söyle tekrar. Ана 2-де 6, мынау 1,4 қой.
Maybe we need. You think we need more tight packing? Because
Usually we need a...
are you planning to put some glue or not?
No, there is no glue.
Huh?
There is no glue, it's a problem.
Okay.
But we can wait 5 minutes and it will thrombose.
Lo voy a dejar aquí para que no se nos contamine con... Estos son burbujas, ¿verdad? Sí.
Повторяю.
Pero bueno, micro. Because remember that this takes longer to do the reflux, okay? Because it is less.
Okay, let's see.
Diffusion is better, so it takes more time to do the reflux.
Okay, let's wait 5 minutes. And now we can ask for second sonic and we can go for the anterior part. At second sonic. Бақыт соник ашып бересіңізші. Соник. 1,25.
The sonic is 1.2 by 35.
It's a 1.5 35.
Okay.
0.5. Yes. Yes. This is without wire. Yeah.
Okay.
It's a little bit problem, huh? Tabr шприц ватасаш набор. Барыкин. Бар. Yes, this time we can use for catheterization. Okay. But I think we moved from this point.
So the best one is the more distal one. Maybe you can get a wedge position in one of these.
Okay, yes. Let's see.
This is 1.5 by
25.
25.
That's 25. It was last 35.
Okay.
Yes, it's a problem with production in bulk, and that's why Sonic is not so widely available. But usually we order 35 because we used to work with Apollo 3 centimeter, and Sonic 35 is better as a regular practice.
I don't know if you can do this.
Let's see.
Yes.
Only lateral. Okay. Let's see.
Yes. No.
I think it was just a second. Let's Физрастов на ultrasound внизу? Да? Стоп. Назад? Okay. It's a different branch. Same branch, but a little bit distally. This one. Төмен дауыспен сүре қосып қоя саласыз ғой.
If you want now to have a more delayed
Yes.
smart mask,
Just a second. Шаг вперед.
yes.
Осылай.
This one. Small branch. Yes. Yeah.
It looks like something indirect. Huh?
Yeah, this is the difference with the 1.2. The 1.2 will go more
Yes.
by itself.
Let's check it. Is it? we can go deeply.
You're far, still far, huh?
Назад. But there is two branches. Huh? It was looked like there is two branches. Предыдущий ангион кажется, Саш? It was looked like two branches. Предыдущий ангио. Бұған дейінгісін айналдыра Саш? Все назад. Yes, it was looked like two, but this one and also this one. Так, келесін. Назад. Yes, it's look like there are two.
But the ability to navigate from here with the 1.5 is going to be limited. What do you think?
Yes.
And
We can
there
take
is
from
a lot
this
of
one.
indirect stuff there, which means this part of the brain is less eloquent, but still some brain in the middle. So why not to do from the other side? Do you want to inject here as well?
Okay, let's wait for this, so let's leave it. Okay. We can go forward, but
Okay.
later. Let's do it with the first microcatheter. Oh, there is less flow.
So remember that Obtura is so hydrophobic, so you have to take a lot of care with the saline.
Let's check it. Like this.
It would be interesting to put the blood pressure at 90. Which is the blood pressure now?
Давлениеңіз қанша болып отыр, Назерке? 86.
86. Okay, perfect.
Так, I think we need to do a
DMSO?
little bit zoom. Dexamethasone 12 мг.
Can we put the this as a
Наркоз
reference?
поглубже, да.
Okay.
Just a second. Alberto, just a second. I will a little bit enlarge the zoom. Yes, it's 20.
20.
Okay, it's 20. Glue. There is some notification, I don't know. What's this? Okay. And the visibility will be different than in squid.
Yes, it's
Start
similar than
penetrating.
glue, 50% glue.
50%, okay.
One third.
I think there is something.
Yeah, it's going to the vein. But just a couple of drops, not sure too much. So that's why it's better to have the blood pressure a little bit down.
Давлениесін 70 қылсаңыздаршы. Назеркеге айтасыз ғой, төмен түсіріп қылсаңыз.
Slowly. Now it's going, I think it's working. I'll take it with the reflux. In this very well. A is good as well. If you want me to reset, just tell me.
Yes. Visit.
Reset?
It's going up. Huh?
Okay, that's good.
AVM.
Very good.
It looks like something bigger, huh?
Yeah, this is concentrating in something bigger,
Yes.
which is a good argument to stop and change things.
Just a second. There is another indirect transmit line. Just a second.
Sí.
Stop.
¿Mm? 20. ¿Dónde lo cojo? ¿Aquí? Sí, vamos a asegurar. Bueno, lo cojo aquí. Esto es de squeak que está... Qué bien te queda esta música a ti. Claro, pero es que se tienen una hora. Gracias.
I think it starts penetrating the vein.
What?
This all stuff is here. Maybe it looks like this part. At the level of
Very difficult.
primary
It's
vein.
very difficult to understand because of the cast. But more or less, I think you did this
Nearly
part.
this part.
Yes.
No, this part, and it looks like this part.
Mm-hmm.
Yes, and it's still AVM.
Mm-hmm.
Oh, it's still AVM.
This,
Okay.
if it's anterior, is okay. If it goes posterior, is But you never know. Maybe it's not going well, but
Yeah.
because of the previous sheet, you don't understand.
Yes.
But I agree with you that in this case, since it's going to be operated, it's better to be cautious with the vein
Yes.
and operate the patient when it is needed, not in an emergency setting.
Now it's a vein, I think. This
Posterior,
vein,
yeah.
Posterior.
Let's wait.
It looks like vein.
So you still don't have glue. Still don't have glue.
It's not registered, and nobody wants to bring the glue. That's a problem. And now we don't see this second branch, huh? It's not filling.
Do you want to take it?
Ah, no.
You want to get it?
I mean, we don't see with the liquid embolic. We don't see this part.
Know what I mean? Where was this?
Yes, it's disappeared. Maybe we compressed with glue,
This is the anterior.
with the liquid embolic. It's okay, it's okay. Yes, it's...
This is going to the deep part. No, but if you reflux there, you will get it. It looks like nidus because it's going everywhere around. It's okay.
Now it should be close to the vein.
Yeah. And I think that some reflux, and then it will start to go to the
But I
the
think
other.
this was AP, and then we changed the angulation.
No, but this is with 38.
It was something here. But it was with 10. That's why it could be too
okay.
parallel. Yes.
Okay. So maybe it's this one, huh?
Yes,
See
maybe.
this one?
Maybe. Yeah.
Yes.
It's more look like. And Carlos, we noticed if you place electrically detachable coils, then it's possible to create a quite nice reflux plug for pressure cooking. We have no glue, we just placed the coils and waited for 5 minutes, and then it's okay. Because in many places glue is not available. Huh? In such a rich country like Kazakhstan, glue is not available. Huh? We have oil, but we couldn't place oil.
Okay, I don't know if this can be a small primary.
Yes, it's look primary way. That's why I stopped. Okay, let's do Andrew. Andrew and check. Then we can go a little bit forward with the second sonic, and we can take all this frontal part of the AVM. Good, good.
Oh, seems to be good, huh? Yeah.
Looks
Which one is
not
this?
bad. It's a frontal one.
This is where the this is
This
where
is
the
just
sonic is. Where the sonic
cranial,
is because
yes.
we changed the
Angulation. Yeah.
angulation. So for a surgical point of view, I think this is good. Maybe you want to do the anterior,
Yes, we can proceed
But-
with anterior.
but the problem with anterior is that you have to go
Yes, I will try to go a
farther
little
and try
bit.
to wedge the catheter. And I'm not sure
Yes.
it with 1.5 is going to be possible.
Let's see.
Yeah, okay. And a good thing is that now you can do
Yes, we can
whatever
do.
you want and leave it there and then go back in 20 minutes without any problem
Oh, okay.
because you don't have tantalum.
Now it's filling something. Eh? It looks like vein. This might be vein. Eh?
Yeah.
Okay, let's wait.
Leave it
with
there,
this.
leave it there.
Okay.
Maybe you can try if while putting more support in the microcatheter with the Chikai 8.
Okay.
This is Chikai 8.
Yes.
Sonic 1.5 has a little bit more.
Okay. Let's,
You can do a supraselective run because we change the
Yes.
anterior angulation.
Okay. Так, нам кутенне не гигзесеш. Okay, let's navigate.
Okay.
Yes. Yes.
I'm not sure if this is true. It would be nice that this is true, but I'm not sure. You see?
Okay, let's see. It will be better if it will go, huh? But it's too stiff. No. It's not going. It's very hard to push.
Yeah, it's too much.
Okay, let's take hybrid.
Now it's going.
Let's see.
Yeah, it's going. Slowly but moving. Do you have 1.2?
There is 1.2. Let's see. Maybe we need to take a hybrid.
Sorry, buddy?
Hybrid. There is hybrid. Let's see with hybrid. Okay. Observe.
No, que no sé qué hice con el 1.2.
Hybrid piensas? Okay. If not, then we can take 1.2.
So you feel a lot of resistance with the Chikai?
Yes, with
Okay.
Chikai a lot of resistance. I couldn't go distally.
Okay.
Namniki user. Son ötküzür. Ötküzür. Has the advantage with this liquid embolic, we can wait, no need to rush, and then we can continue to inject. It's very nice.
Yes, this is one of the good parts. You can work relaxed, take another feeder while you wait. And many times what we found in this situation is that it goes when there was a remnant, because you also take time for solidification and precipitation of the liquid embolic in many structures, and then it goes to the small ones, which is good. Great. Good. It's going, it's going.
I think it's
Too much
the limit
resistance,
is too
huh?
much. Yes.
Okay, so
No, that's better. I think the headway could not proceed to this part.
no. We only use the 1.2 sonic. Maybe you have the risk of catheter occlusion.
No, it's
You are wet.
wedge.
You are wet.
It's good. Huh?
Yeah.
Okay.
So what do you want to do? If you inject now, it will go forward
Yes,
without
let's inject.
any pressure cooker.
Yeah. I will take out the headway.
Do you want to try from here?
To inject from here, yes.
Yeah?
Yes.
Okay, so you want to try Obtura 20 here?
20. I think 20 is okay.
Yeah,
No,
okay.
let's do 20.
DMSO.
Okay, let's inject something from here. Oh, glue. Glue. I will inject a little bit more. There is a reflux.
Reflux.
Now it's time to wait.
Did you wash with saline?
Yes.
Okay.
Then I think Arturo should be colored, yes? The green, or they need to put color.
Yes, they are doing that.
Like lemonade.
Yeah.
Yes. Okay, it's
Okay,
coming.
it's coming.
The problem is we couldn't see the reflux, huh?
You see the tip of the catheter is there, okay?
Она экранга нам суперселективным ходишь? Бо.
No sé ni de qué es esta. ¿Hay jeringas nuevas? ¿Esto qué es? Tura. Esta es la que acabo de coger de MSO.
I think now we're very close to the vein. On AP it looks like we're around the primary vein. But on lateral it's okay.
It's okay, man.
Is it? Yes, in your place maybe it will be end with the transvenous approach, huh?
You can go for the deep part, sure. But,
I need one more.
sorry, a little more.
Maybe I need more. Oh. Yes, the deep
Hey,
part.
I need needles. You can try the other one and then I go for more for you.
Okay.
Do you have penetration from here or not yet?
Yes, it's penetrating.
Yeah, it's going distally, okay. Would be nice to go from the, okay, take care. Yes, this is not reflux but anastomotic network behind. You know?
Yes.
Because the tip of the catheter is not. Okay, so let me give me more. This is new?
Then, Carlos, you need 10 cc bottles.
You're not the first to ask.
Okay. I think it will be from United States, yes? They want everything big. It's just
You
joke.
can reset like this. Push the pedal.
Okay.
You change the quality of the underneath automatically. You know?
Okay. Plus, minus.
All this, some change in the quality of scopy.
Okay.
It will reset the roadmap.
Okay, let's inject from the first microcatheter.
I think that now you're feeling the deep compartment,
There is also
but
reflex.
if you have a reflex, so this is why if you had glue now, you could improve diffusion, huh? Because you will stop. I think that clot is a good pressure cooker until some point
Yes.
when there start to be a lot of distal resistance. So
Then
I think that
it's
we are
coming
limited
back, yeah?
because of
Okay.
this.
Okay. And this
Has
is.
traído un 35 de esos que decía
Sí, pero al final no para.
pero de los que decía Juan Carlos.
I think it's a reflex now, no? Yes, it's like
Now it's going.
but it's reflexing, no?
Can you see? Are you sure this is? Yes, you have
Yes, it's a
reflex.
reflex.
Yeah. But it was also.
Yes,
You
it's
think it
forward
was
and backward,
also-
no?
Okay, so this is done. What do you think? Are you taking the headway
Yes, headway is out.
before pulling back the catheters to avoid straightening of the vessel? The thing you should learn from you.
Let's go. Yeah.
Okay, why not?
First of all, we will take the second one, eh? The first one.
The more
Thi-
anterior.
this part,
Okay.
yes.
Yeah.
Okay. I think I have seen this technique from Zolt Kurksar.
Oh, okay.
On
I learning
one
from
of
you.
the-
I learning from you.
Yes, me. It's very useful technique.
Yeah, it works. Because even if a subarachnoid hemorrhage is not very important, sometimes you have, especially if you have a remnant of the AVM, still arteriovenous sound, shunt can be dangerous. So you can avoid it like this. It's simple maneuver.
Yes, simple and safe.
Yeah.
It was in 2012 or 2013 on one of the ASMIN. I have seen this technique.
Okay.
It's a long time, no?
Bueno, este parece que ya está, ya no quiere meter más. No sé qué, este parece que ya no quiere meter más. Ha sido bastante prudente. Luego le van a operar, pero tampoco quieres perder.
Depende de que hay un bicho bastante muy fuerte.
Уже ножицы. Чуть лапшер. Чуть-чуть надо развернуть.
No, se ha ido, o sea, el líquido ha hecho lo que tenía que hacer.
No, eso no, la arteria.
Eso es meninges, nada más meninges. If you take the branch with the wire like this, it's a miracle. But you do miracles, so this is not.
Okay.
No, this is distal. You have one here
Okay.
and the other one there.
This is this one. Yes, I forgot.
Okay.
It's okay.
This is the less traumatic way to navigate, huh? Okay, so you are close to the first one.
I think it's enough. Now we're in place. Close it. Inject a little bit. Okay. Let's inject a little bit.
You want to try a little bit more?
Yes.
Okay.
Ah, it's refluxing. Slight reflux.
I think it's going to the deep part because the branch that was proximal is, now is in parallel to the. If we go back to this, the first angulation you had, it was like 10.
10.
Take a look. Yes,
Yes, it's
this is the branch. So maybe we can try to inject here and you see
yes, we can inject like that.
better.
And then we can inject from the frontal part. Okay. That's a reflex.
Ah, this is reflux. Yes.
It's penetrating, yeah.
It's going in the other compartment. Superiorly.
And it's refluxing.
Seems to be, yeah. This is seems to be this part here where is some kind of vein going up.
I think it's time to stop with this branch.
Yes, I think if
it's
the
better.
patient is going to surgery, it's so prudent to
It's
stop
better to
here.
stop, yeah.
Maybe if you can still have some advantage, but you can have also the disadvantage of venous outflow problem.
Yes. All this stuff.
I think it's time to stop, yeah. The vein is, because of proximal flow reduction,
And the only point we can do functional MRI to find the motor cortex, and if it's more posterior, then we can go at the next time and take this part also
okay.
after functional MRI.
Okay, so
Otherwise-
let's take this out. Another thing of Optura, if you don't have glue, maybe the catheter can come
Easily,
completely,
yes.
okay?
Ah, okay.
You want to take the around my back?
That's
No, you don't
okay,
need it.
that's okay.
You have enough.
Okay.
Okay, came with no straightening of the vessel. That's good.
Estuvo.
Y sutura, ¿eh? ¿Qué hacemos con lo que ha sobrado? Es 20, lo dejamos para la otra, ¿no?
Okay.
Hey, ship works, huh?
Yes, it works.
Shipping works.
Thanks to Rene for explaining nice technique. Eh?
This is a hybrid coil.
Yes, and then it's possible to rotate around the
Yeah.
microcatheter and then the wire will follow. I learned from Rene this also. Okay. We can place one more coil. Huh? I think it's okay. Ah, we can wait here.
Yeah. Great.
See. This at 30. Okay, 10 is okay. The most reflex we can see on lateral.
I think that if you're not in wedge position, it's going to come back.
Okay, let's
Yeah.
see. It's going somewhere. Yes, it's proceeding. I'm doing very tac injection. Yeah?
It's like it's in some part of the collateral network, isn't it? Yeah.
It's not like reflex.
Because this is a reference image. Now you're in the same projection. And
The
going
catheter
behind
is
this
like
point.
this.
So
Okay, let's inject a little bit more. And no, it's more reflex.
there's reflex.
Yes, it's a reflex. Okay, I think it's time to stop.
Yeah.
I think it's enough. Okay, let's wait.
Take your time, no problem.
Let's wait a bit. Bir не жинап қоясыз, демосы. Демосы жинап қоясыз. Okay, let's wait. Yes, we cleared all this frontal part of AVM.
Yeah,
and,
this is so tight curve, but still not. You didn't straight it in.
yes. Because of this second microcatheter.
Are you still pulling?
Yes, it's in
Keeping-
maximum.
Okay,
Yes.
perfect. Maybe the problem is because you don't have any proximal plaque. It's still applying tension to the distal tip,
Yes.
and maybe it will come.
Okay, let's
Sometimes it happens, but I think it's okay to put some DMSO.
Let's see. I just put the medallion.
This is altura.
The doctor is
It's coming, huh? The catheter is coming.
okay. Catheter is coming completely.
Yeah, so
Yes, now it's came completely.
it's coming completely. You see? came completely.
Just a second. Let's do angiography. Okay. It's like in a fill, yes? The fill is behaving maybe a little bit similar. Usually there is no strong reflux. It's
There's some very indirect stuff going then to the nidus, but this should go for surgery. I agree with you.
I'll see. Okay.
Because you don't understand the vein, you know?
Yes.
Even if you can take it be close to the vein, you're going to inject like this.
It's blind.
Mm.
Yes.
This is 20? Obtura 20?
It's 20.
Okay.
Yes.
Tenemos un problema con las jeringas. Tendríamos que traer agujas, me refiero, para la próxima vez que vayamos fuera, a sitios que no lo sabes. Sí. Sí. ¿Quieres coger todo esto? ¿O no? No, esto ya no.
Tendría que tener suficientes.
Vale.
A little bit back.
Interesting case.
Okay, there is no questions from the auditorium. The Zoom is connected, and if you have any question, you can text, and Enzo will look for the text. But if there is no question, let's see.
Las agujas gordas.
Yes, the brain is okay. There is some spasm. Келесі пациентке промывкаларға нематоп қосып тастайсыз ғой? Хорошо? 8-8-ден қосып
You cannot do that.
Yes.
Look at the proximal origin.
Okay. Так, КТ один провершен. КТ Степановна гномс есть. Окей. Да, КТ. Окей. Келесі пациент шақырыңыз. Let's wait for control CT.
No.
Okay, nobody in Zoom. Okay. Thank you.
Yes.
Thank you. SKT.
Consider to go more formalization?
MR will show safe position.
Okay.
Then we can go from the posterior part. We already checked, and I think it's okay. Let's wait for control CT.
One thing that would be interesting is to do the deep part transvenous.
Deep part transvenous. Okay.
But depending on how surgeons feel with this, with the deep part of the AVM and the location of the, because for me this is
more dangerous part. More bleedy part.
bleedy and eloquent.
Звук можно пока оставить, Наталья. Все, быстрее. Now we are waiting for control CT. It's 21 seconds. Yes, it's okay. Also aneurysm. Okay. CT is ready. It's a Philips, and No need for additional movement like in Icona. It's just joking. Yes. The brain looks okay, and
And you don't see anything because of tantalum.
because of tantalum, yes.
But bu yaşa. Azın çıktan gelip içerim.
Neuromaxer. Neuromaxer. Okay. Because of tantalum, but lateral ventricle is okay. The position is okay, and these branches also okay, and subarachnoid space and Sylvian fissure is also okay. Now we can finish the case and see you in next 40 minutes. Next case also occipital, parieto-occipital AVM, the posterior part of the corpus callosum. Okay, let's see. See you in 40 minutes. Thank you. So, sure.